maybe just one or at the most two. So here's the instruction. The instruction is I've already given her the gauze. So she's going to put 30 minutes of pressure there. And if she doesn't have to change out the gauze, that's fine. It's just to slow down or stop the bleeding. Make sure you don't. I have another instrument there to make sure that that area is clean. Open. So, actually, if we want to, we could go ahead and put a suture here, right? Mm-hmm. What you want to do is stop this bleeding a little bit. So we're going to put some pressure here. Okay, so it looks like that. But we're going to make a decision to either put a suture here so it'll close like this, right? We could actually leave it like that and let it heal, but so we're going to use suture material. So that is like this. So we've got a needle, suture, maybe just one or at the most. Take a look at it. We can just do one, so that it'll just be closed. So I close that with just one, or maybe I could do another one, but I just want to make sure that the tissue does not flap all over. So, in this situation, you could do one, you could do two, you could do 3 stitches here. I'm just hold it there so that the gun closes up a little bit. Or you don't, in this case, sometimes I don't even have to put a stitch. I just close it so that it'll keep the food from going into that socket. Okay. So the other instruction that you get when you're having tooth pulled is using a syringe, water, sometimes it's warm salt water. So when food are getting stuck in there, what you're doing is you're going here and then you're just putting water in to get the food stuff out there. So if this was not open. So if this was not closed, food will get into that hole. And then you can just go ahead and just clean it up like this, okay? But I think she's gonna be fine. So just not open. See, that's how it looks, closed. So you could put 0 stitches, 1, 2, 3 stitches, but that's gonna be depending upon the clinical situation and also the patient. So here's the instruction that I usually give. So you could either take 1 or 2 gauze like that. In this case, I could use 1. And then she's going to put some pressure on this for the next 30 minutes. Right down. Yeah, there you go. And then close. So here's the instruction. The instruction is I've already given her the gauze. So she's going to put 30 minutes of pressure there. And if she doesn't have to change out the gauze, that's fine. It's just to slow down or stop the bleeding. Make sure you don't get the clot that's in there remove, because what we're going to try to prevent is what they call dry socket. So if you could keep the clot in that hole where the tooth used to be, I think this is going to heal fine. So we're just going to see how this heals. We're going to have it come back maybe a couple of weeks to 3 weeks to remove the stitches if it hasn't come out by itself yet. And then that's all you need to do when you're taking out the mold. How is that, right?